Thank you. Good evening, everyone. Uh, um, this is now Alvin live. Thank you for joining us tonight, and thank you for all the messages coming from our partners and friends. Ahin has reached this point where we are now in the midst of a pandemic, and we suddenly find ourselves scratching our head and realizing we had 9 years preparing for something, but it took a pandemic to really hasten everything up. So allow me, dear friends, to present to you our call to action. For the past 3 months, we have been convening our working council members. The working council members are senior leaders of digital health in the AHIN countries, mostly in Asia Pacific. And we brainstormed with them and agreed that this would be our call to action for this general meeting. Subsequently, in the next few weeks, we would then have our marketplace and partner share, and then from there consolidate response to this call to action. So I'll ask my team to share our slides on our call to action. For those of you who are not yet familiar with AHIN, this is your first time to hear about us or join us. We started way back in 2011 in Hoi An, Vietnam. In 2011, WHO and USAID hosted a conference in support of the Ministry of Health Vietnam. And the title of the conference was Health Information Systems Interoperability. Next slide, please. And the idea behind the conference was to understand why it was very challenging to get interoperable systems in a country. And in that meeting, many of the countries, the ministries of health who were in attendance, realized that they did not have interoperability even inside their own ministries of health. So it would be practically impossible to get the private sector to be interoperable with government if government itself was not interoperable within themselves. So in a way, that conference was a wake-up call to everyone that, okay, this is a problem. It's not just one Ministry of Health. It's basically all countries who were there agreed that we had to fix this interoperability problem, or else we will always have fragmented data. The TB data is not interoperable with the HIV data, not interoperable with the malaria data, and it's very difficult to make plannings and decisions without interoperable data. So we ended up in a sort of like a sad note, but the positive side of it was that everyone felt like we were all in the same boat. So we felt like we were passengers in the same ship. That was in a way a positive thing. Now, luckily, a few months later, June 2011, mostly the same group of people met again in Manila, now under the auspices of WHO Wipro and the Asian Development Bank. And in the beginning, we were again talking about the problems of interoperability. So it was in the middle of this June 2011 meeting when we gathered together informally the first group of AHIN uh, founders, including Dr. Bunchay, Anis, and Dr. Phung Kam, and Professor Huong from Vietnam. And we said, we can't just talk about the problem because we already know that there's a problem. We should be thinking of solutions. And in that meeting, Thailand was talking about their standardization of the drug terminology, how beneficial a national ID system was in support of their universal health coverage. Malaysia was talking about their telemedicine and their initiatives. So we thought that if we all put together our mini solutions, we could probably come up with a set of packages that other countries can adopt. You know, you can pick and choose. If you like this, if you like the Malaysian solution, then it's there for you to take on. If you like the Thailand solution, then you can get the material and you can reference the Thailand experience when you start presenting it to your own Minister of Health. We thought that was a more powerful way of getting digital health and e-health into higher levels of awareness of our ministers of health. So that was the start of AHIN. From that meeting, that small group of people became the Asia eHealth Information Network. And in December of 2011, we got support from WHO. We met in Bangkok and formalized what we call now the Asia eHealth Information Network. Next slide, please. So the first meeting, general meeting was in Bangkok, August 2012, and this is where the launch of the WHO ITU National eHealth Strategy Toolkit was done. As you can see, there's about 100 to 120 people in that meeting. Next slide, please. The second general meeting was now in Manila in the middle of a storm. There was a flood all around the conference area. And this is where we had countries undergoing a regional training on the WHO ITU National eHealth Strategy Toolkit. It was also in this meeting where we started to form the AHIN Working Council. The AHIN Working Council are basically the leads of digital health in each country coming together and forming an informal group of advisors to AHIN. Next slide, please. The third general meeting was hosted by ADB inside their premises in December. And this was where we had our first AHIN call to action. If you saw the two hands earlier on in the earlier slide, that is what we call the IC10. That was our call to action. 10 actions countries can take on if they wanted to start using ICT effectively for their health information systems. This is also where we created a subgroup inside AHIN called the Research and Academia subgroup, a very active subgroup, publishing papers, talking to each other about what's new over there in your country. And also, this is where we launched our IC10. Next slide, please. The fourth general meeting was in Bali, Indonesia. And this is where we just came from the Global Health Research Forum and agreed that we should have a way to improve the way countries design blueprints for its digital health system or e-health system. This is at this point in 2015, we realized this health information systems interoperability is very complex. It's not just technology. There's a lot of human processes around it. There's a lot of governance and management before you even talk about the technology. And we thought that we needed to have enterprise architects in each country that can guide the Ministry of Health, the Ministry of ICT, the Ministry of Finance, create a blueprint that everyone can follow. So that guided by a common blueprint, the Ministry of Health can conduct its projects, the Ministry of ICT can conduct their projects, the Ministry of Finance, the Ministry of Agriculture, they can proceed with their own projects, but they're all referencing the same blueprint. And because they're doing it, because they're referencing a common interoperable blueprint, they can actually work separately, but they're creating components of a complete picture. So this is why we formed the AHIN Regional Enterprise Architecture Council for Health. This is a group of 30 people, at least 2 from each country, who were trained in the Open Group Architecture Framework, or TOGAF. TOGAF is a ISO standard methodology for creating blueprints. So the reach is available. It's a resource inside AHIN. Some of them are inside your Ministry of Health. You might not know it. So start asking. If you want to know more about these people, please contact our secretariat and we can supply you who is your certified enterprise architect in your country. They are very important resources for you. Next slide, please. The fifth general meeting was in Naypyidaw, Myanmar, March 2017. A few months before this, in Washington, D.C., the World Bank, WHO, and USAID launched the Measurement and Accountability for Health. And AHIN was one of the participants in the MA for Health. And we came back, talked about the call to action of the MA for Health. Then we said, oh, we can actually respond to this call to action of MA for Health. This is a good way of gathering people to work together and do something collaboratively. So we formed what we call the Mind the Gaps as a way to respond to the MA for Health call to action. And this is where we said, we think the solution to the problem of health information systems interoperability, we need to have G, governance, we need to have A, architecture or blueprint, we have to have good program management, and then we have to have standards for interoperability. So that was launched in Epidao, and we are happy that the Minister of Health Myanmar actually embedded Mind the Gaps in his call to action as well, in his keynote speech. Next slide, please. So you might say Myanmar is one of the first adopters of the Mind the Gaps approach. In the sixth general meeting in Colombo, October 2018, we realized that once you have the governance, there's a blueprint, there's program management, and there's standards. People were still lost. Okay, so what do we do? What do we do with all of these? So this is where the 18 members in that meeting decided, why don't we put up interoperability labs in each country so that the stakeholders can go to these labs and see this interoperability in action? Because interoperability is such a vague concept, and unless you see it in action, you really don't know how it's going to work or how it's going to look like. So this is where the community of interoperability labs was born. And this is from the support of ADB when they formed the Standards and Interoperability Lab Asia inside in Manila in ADB, that would become a reference laboratory and make their tools and techniques and materials available for each of these country interoperability labs. We had about 6 countries in Colombo who raised their hand and said, we're interested in setting up our country interoperability lab. So if you want to know more about how to set up your interoperability lab, please stay and contact our secretariat, and we will show you how to get resources from the Standards and Interoperability Lab Asia. Next slide, please. And so now we've reached our 7th general meeting. I've already given a talk about what are going to happen in the next 4 weeks. Next slide, please. And so now we'd like to proceed to our call to action. For this next 4 weeks, we'd like to repeat the message of minding your gaps. You have to be conscious about whether you have the right governance structure. You have to be conscious whether you have the right blueprint or architecture. If you don't have a blueprint or architecture, then people don't know what they're going to build or what their role is in the bigger scheme of things. Do you have good program management? And do you have standards for your interoperability? So I'll go through each one by one. Next slide, please. Governance is basically our call to action is for stakeholders to support the leadership of the Ministry of Health in developing national digital health strategies that respond to the complexities of the pandemic response, such as disease surveillance, testing, contact tracing, quarantine management, and clinical care. In turn, the Ministry of Health shall cultivate a conducive environment for the formation of public-private partnerships to foster much-needed collaboration. This pandemic is bigger than any one of us, and we can only solve this if we support our Ministry of Health. But the Ministry of Health should also be able to welcome all people who are willing to help. So our call to action for governance, multi-sectoral coordination mechanism. Next slide. Now, one of the first things we think the governance, the multi-sector coordination, is to agree on the blueprint. Before you build something very complex, we need to be clear that we're building something that we're all agreed on. So pandemics require reliable information to flow across different stakeholders. We realize this already. To enable secure data sharing, countries are encouraged to share a clear interoperability blueprint for adoption by all. This blueprint should be useful for COVID-19 and other health programs of the Ministry of Health. We recommend engaging a network of professional certified enterprise architects to advise government and development partners on its formulation. For example, the Regional Enterprise Architecture Council for Health. So for our call to action for architecture, there should be a shared enterprise blueprint for all to see and follow. Next slide, please. Now, once you have that blueprint, there will be parts of that blueprint that will be very important, like your client registry or your master list of citizens, your provider registry or your master list of providers, or the facility registry or the master list of facilities. We call upon stakeholders to support the MOH to strengthen the capacity and capability of their National Program Management Office or PMO. This includes developing capacity within MOH to manage digital health projects and establishing a pool of certified project managers for the PMO. The MHO may leverage regional learning networks like AHIN to catalyze knowledge exchange across different countries in Asia. We invite the MOH to nominate their digital health project management officers to join a network of other project management officers from other countries so that they can facilitate their network learning. Our call to action for program management: please create your national e-health program management offices and let's make them into a network so that they can learn faster together. Next slide, please. For standards interoperability, our call to action is we request open access and technical assistance to international health standards like ICD-10, ICD-11, and HL7, Fast Healthcare Interoperability Resources, or FHIR. These health standards are crucial components of the interoperability blueprint, which will enable the availability of health data for better monitoring of population health. Our call to action: make standards accessible and let's build interoperability labs in our country to make interoperability more concrete experiences for all our stakeholders, public and private. Next slide, please. So thank you very much. That's our call to action. I hope that in the next 4 weeks, including tonight's country presentations and country dialogues, we can see that this call to action is a request for help, but also that the next 4 weeks is a response to that call for help. And I hope that you can join us in the next subsequent activities so that as these solutions are coming out from governments around Asia, from development partners in other regions, we can come up with a comprehensive solution that will become the roadmap for AHIN's interventions and activities for the next 3 to 5 years. So thank you very much, and I'll ask my senior members if they have other things that they want to add to action. Don't forget, mind the gaps and fill the gaps. So may I do ladies first, Dr. Fazila?
Yes, thank you. Thank you, Alvin, and thank you. Welcome everyone to our AHIN General Meeting, which is actually our is an annual gathering to discuss the latest trends in digital health, mainly in the area of gaps, as mentioned by Alvin. So I really hope all our call to action will be supported and taken up by all the countries. So please come and join us in this network, and let's bring digital transformation to the next level. Thank you. I pass to you, Bunchai.
Okay, thank you. I really happy that we saw good old friends, and I still remember the day of the opening of every GM. We will do I will do kind of the twins introduction with Dr. Alvin, but this year we cannot do that. We do only one by one. This is a kind of one of the experience that we experiment how we're gonna live with this critical moment of the COVID-19 pandemics. So with the next 4 weeks, every Thursday, 2 hours, I hope that everyone can keep some time to join us, and then let's experience together how we're gonna address the next 5, 6 years. If we cannot see each other face to face, how we gonna do it better? But I hope that in the next 2 hours, we gonna have a very fun discussion with the member state of WHO, first with Wipro and then with Zero. Over to you, Jai.
Thank you, Dr. Bunchai. I would like to welcome all of you who have joined together virtually. As Dr. Bunchai mentioned, it would have been a pleasure to meet you all in person, but thanks to COVID, we are at least able to meet virtually. But it also gives us an opportunity to probably for more people to meet. That's what we have seen over last several events. As Alvin has mentioned about various gaps, I would like to also add couple of things which seem to have been major pain points expressed over several of the digital health events over the last 1 year. many of the complaints that came in from colleagues where there are too many digital tools. There are too many digital tools and guides, but there is less support for people to actually make use of them. So I think this could be one of the areas that we could probably think over, come together and see how we can make use of those resources that is available for the countries. This could be one of the areas that I think probably even the development partners and the government could probably think how we can support countries to make use of these tools which are already available. Another pain point that came up in the early part of the pandemic is at the time when we were supposed to actually start using the very tools that have been created for the purpose, people were still evaluating whether it fits the need, whether it is in a position that they can readily consume or start using it. So these are the things that probably I think we should now discuss more, and then also share what exactly did not work apart from what worked. Thank you very much.
Thank you, Jai. So I think we are right on time. I was told to give everyone a 2-minute break before we start our first set of countries that will be moderated by Dr. Fazila. So everyone, you can take your break. You have 2 minutes and please come back because we will have a very exciting set of panelists. See you.